tell me about what happened and when did that happen?
I got dropped onto a concrete sidewalk December
Mhm.
19th, 2019.
And you lost lots of function, correct?
I couldn't walk without my walker, and I had a hard time getting up to use my walker.
And you had horrible pain. How bad was the
Very,
pain?
very bad pain.
Tell me about it. How bad was it?
It was so bad that when I would be sitting at a table in the
Mhm.
dining room area, tears would just pour down my
So
face.
that is by
because-
definition 8, 9, 10. About right?
Mhm.
And it was a path for you and I get together and find out what's going on. But I'm just going to jump to what the problem was. You had a completely broken bone in the S1. Practically, you have a fracture subluxation of the sacrum, where this bone wasn't only broken, but it was shifted significantly.
90-degree fracture.
Yeah,
That's
and
what Dr. Ragland at
Yeah.
Lake Region Healthcare said.
And what we looked at as well, that practically some of the nerves were damaged, but as well the energy of that fall as well destroyed some lower disc in your spine, and it was hard for us to understand, what pain comes from the broken bone, what pain comes from damaged discs. And you and I, we discussed and we did the first stage of the surgery about, what, 5, 6 months ago? When did we?
September 11th.
So about
2020.
about 5 months ago. And now, how are you now? How is the pain?
It's about 5-6 now.
So it's much better than it was.
Yep. It just bothers me once in a while. I'll have shooting pain up my back, but that's all.
Yeah. Now, you had obviously some function loss from the fall and the bone, and we discussed that. That is would be unrealistic, about a year after the fall to be able to get that function back. And we did the surgery just for pain management and stabilizing your spine. And so far, I have the feeling we are going the right direction, even though, you didn't get the function of some of the nerves they were damaged back.
Yeah, I'm
But-
still numb below my waist.
Yeah, but this is what we are dealing with here. Here, this is practically broken S1, and this piece was supposed to be here. And yeah, it is a quite significant fracture. Now, we notice as well that practically your spine with this angle is unstable, so we stabilize your spine by putting screws in L4, 5, and S1, and we set as well, this is just the first stage of a 3-stage procedure where we are going to fix the pelvis and the spine together in a minimal invasive sacroiliac fusion. And before the surgery, we have a panel in the inspired spine, very experienced surgeon. We talked about the open surgery. We're trying to make the picture look good. We have to break your bone in the pelvis in 20 different places and realign it, and that would have been a practically prohibitively dangerous surgery. And I didn't give you that offer because I don't believe that's a good option. That would be damage would be worse. But we did a minimal invasive OLLIF procedure to stabilize the bone and the sacrum for now, and then the next step is to stabilize the pelvis and the sacrum together. But we are already going the right direction. I think your pain is getting better, you told me, correct?
Yes.
And as well, the ambulation, walking is getting better. And what we see here is that actually still that dark line in the sacroiliac joint indicate that joint is in a horrible shape here. And the next step is to fix that area. So regarding the walking and ambulation, what do you notice and how much better are you getting so far already?
I don't understand.
You're walking. How is your walking these days comparing
It's
to before
okay.
the surgery?
It's okay.
It's getting better a little comparing to how you were
Well,
before the surgery?
I didn't have PT for a long time, so,
Yeah.
and I just started up again, so.
Okay, good. But at least now that your spine is stable, we can do a good physical therapy and keep you on your feet. Now we are not even done, and we are going the right direction. And I think that is some kind of advantage of doing this surgery minimally invasively, because as my colleague said, that if we would have gone open old-fashioned way here and start drilling here, the anatomy would be so unchanged. We would have most likely gotten into your nerves and the what we call cauda equina, and you would have lost. We would have opened your central nervous system to outside. High risk of infection, huge risk of problem, and so on. We didn't have any of those problems because we did not open you up old-fashioned way. And that is the advantage of this kind of minimal invasive that enable us to get the job done with much, much less risks, okay? And this video is, that it seems that we are going the right direction, at least at this point. Even within the last 5 months, your pain that was up to 10 is now up to 5 and 6, and we haven't even finished the job, okay? Any question for me or any comment overall? So far happy with the improvement?
Yep.
Okay, well, thank you so much for the interview. I appreciate that, okay?